All right, you've got an exam coming up on prenatal development? Well, you are in exactly the right place. We are going to break down this entire 38-week journey into a super focused, easy-to-follow study guide. Let's make sure you're totally ready for test day.
So here's our game plan. Think of it as a roadmap. We'll start at the very beginning, with the spark of life. Then we'll see how that initial blueprint gets built. After that, we'll cover the major growth phase, look at the risks along the way, and finally, finish with the baby's arrival. If you can master these 5 parts, you are going to be all set.
You know, everything we're about to cover really fits into these 3 major stages: germinal, embryonic, and fetal. Think of them like the foundational chapters for this whole story. If you can get these down, all the little details will make so much more sense.
Okay, first up, the germinal period. This is the absolute beginning. We're talking about those critical first 2 weeks, from the moment of conception to the moment that tiny organism successfully implants itself in the uterus.
It all starts with this just incredible journey. See, deep inside the fallopian tube, fertilization creates a single cell. But that cell doesn't just sit there. No way. It starts traveling towards the uterus, and all along the way it's dividing and dividing, transforming itself until it's ready to find a home in the uterine wall.
Now, these 3 terms, I guarantee you'll see them on your exam, so they are non-negotiable. That initial fertilized egg, that's the zygote. As it develops into this little hollow ball of cells, we call it a blastocyst. And that absolutely critical moment it attaches to the uterine wall, that's implantation. Zygote, blastocyst, implantation. Got it?
And get this journey is incredibly high stakes. A staggering 70% of zygotes never actually manage to implant successfully. It's a really powerful reminder of just how fragile this very first stage of life truly is.
So this brings us to a classic exam topic, twins. And it's actually pretty simple when you see it laid out like this. Identical or monozygotic twins, they start as one single fertilized egg that splits in 2. Fraternal or dizygotic twins come from 2 completely separate eggs that were fertilized at the same time. So one blueprint versus 2 separate ones.
Okay, once implantation happens, we enter the embryonic period. This is from week 3 to week 8. And if those first 2 weeks were all about, just getting to the job site, this period is where the actual construction of the blueprint begins.
Now, I need you to pay super close attention here because this is by far the most vulnerable period of development. And why is that? Well, it's because literally every major organ and body system is being formed right now. The foundations for the brain, the heart, the limbs, it's all being laid down.
This chart shows you exactly why this period is so sensitive. See those red bars? They show the critical windows for major structural development. Just look at it. The central nervous system, the heart, the limbs, the eyes. All of their foundational work gets done during this embryonic period. Any disruption here can have really major consequences.
So, how does all this happen? Well, the embryo organizes itself into 3 primary layers, what scientists call germ layers. Just think of them as the master tissues. The ectoderm, that becomes the outside stuff like your nervous system and skin. The mesoderm forms all the middle structures like muscles and your skeleton. And the endoderm, that creates the internal organs like your lungs and digestive tract. One of the very first and most important events is the formation of this neural tube, which is a precursor to the brain and the spinal cord. And what is just absolutely amazing is that by day 21, a primitive heart has already formed, and it actually begins to beat. I mean, the speed of development is just incredible.
All right, now we enter the longest stage by far, the fetal period. This goes from week 9 all the way until birth. So, if the embryonic period was about drafting the blueprint, this stage is all about the construction, the growth, and all those finishing touches.
This is where brain development just goes into overdrive. The creation of new neurons, that's called neurogenesis, it just explodes. I mean, just try to wrap your head around this number for a second. 200,000 new neurons are being created every single minute. It's an almost incomprehensible rate of growth.
And you can really see the progress in these major milestones. By the 3rd month, the nervous system is connecting to muscles, which leads to things like kicking and even thumb sucking. By the 2nd trimester, the fetus can respond to things happening outside, like light and sound. Then, those final months are all about crucial preparations for birth, like maturing the lungs and establishing sleep-wake cycles.
And get this, it's not just physical growth. It's actually pretty remarkable, but learning is already taking place. We have studies that show fetuses can recognize their mother's voice and can even remember the rhythm of a story they heard over and over again in the womb. This is development on every single level, physical, sensory, and even cognitive.
Okay, let's shift gears a little bit to a critical topic. I can pretty much guarantee you are going to see this on your exam: environmental risks during pregnancy.
You need to memorize this term, teratogen. It's any external agent. It could be a drug, a disease, a chemical that can cause harm. But here's the key thing to remember. Its impact isn't a simple cause and effect. The damage really depends on the dose, the timing of the exposure, and the unique genetic makeup of both the mother and the child. It's complex.
It's honestly pretty humbling when you look at this. For most birth defects, over half, the cause is simply unknown. But when we look at the known causes, we see that a big chunk of them are multifactorial. That just means they involve a complex dance between genetics and the environment. And that is exactly where teratogens come into play.
And you know, these risk factors aren't just on the maternal side. Paternal age matters too. As men get older, the number of new, spontaneous mutations, what scientists call de novo mutations in their sperm, actually increases. And this can, in turn, raise the risk for certain disorders in their children.
And now we've reached the final stage, arrival. So let's take a look at the process of birth and how a newborn's health is assessed in their very first moments of life outside the womb.
The process of childbirth itself is a clear, predictable sequence. It's triggered by hormones that start uterine contractions, and it unfolds in 3 distinct stages. First, the cervix dilates. Second, the baby is born. And third, the placenta is delivered. Nice and straightforward for your exam notes, right? In the very first few minutes of life, newborns get their very first test, the APGAR scale. It's a quick assessment that scores 5 vital signs, and the name itself is a really helpful acronym: appearance, pulse, grimace, activity, and respiration. A total score of 7 or higher, that's a great sign of a healthy start.
So I think the key takeaway from all of this is that the 38 weeks before birth are not some passive waiting period. Not at all. It's an active, dynamic journey of construction and even learning. And that leaves us with a question that goes way beyond any exam. Knowing everything that happens in the womb, where do you think consciousness truly begins?